All right, guys, welcome to my presentation on collagen supplementation for osteoarthritis and joint health. If you're watching this, this is going to be a YouTube video. I had some technical difficulties with putting this on PowerPoint, so bear with me. Hopefully this won't take away too much from the substance of the presentation. So let's first get into what exactly collagen is. So it's important to know first where we find it. Primarily we find this in hair, skin, nails, bone, tendon, ligament, cartilage. You essentially find collagen everywhere. And that's important because it's one of the major components that helps us create strong, resilient cells, strong, resilient tissue. And as you can see, a lot of the mentioned areas there, bone, tendon, ligament, cartilage, skin, hair, these all withstand tremendous amounts of force, and collagen fibrils are one of the main reasons why they're able to withstand that much force. So these places are what we call deposit sites, and we have collagen differentiation depending on where the deposit site is. We have different types, 1 through 5. So type 1, we're going to find in skin, tendon, much of your vasculature. That can be in the organs and also in the bone. So this is going to be a really stiff type of collagen that helps give our skin a lot of the compliance, but also allows it to return back to its original shape. Type 2 is mainly found in cartilage and articulations. This is going to be a major focus of what we're doing today in the presentation. Type 3, so mainly this is sort of a supplementary collagen that we're going to find in the reticulate, and types 4 and 5 are going to be a little bit less prevalent, but still important. So it's important to understand that throughout these types, even though we have different types, it's generally made of the same stuff, same components. That is important, and an important continuation throughout the entire presentation is that all of this collagen is pretty much the same stuff. So why would people use it? Well, it's considered to be, depending on which application you use, it's considered to be an enhancer, right? An ergogenic aid. So it's going to help with skin health, nail, and hair function. But more importantly, and more important to our presentation, to my presentation today, is this is going to support tendon, joint, and bone health. So how does it work? So if you want to understand how collagen works, you have to understand how it makes its way into the joint and sort of the inner workings of the actual articulations. So in normal cartilage, what you're going to find is that between 65 and 80% of the actual articulation is water in terms of the cartilage. So you have a very liquid and viscous material that is cartilage. The remaining dry weight, so if you have the wet weight, the dry weight is going to be made up of collagens and proteoglycans, chondrocytes, stuff like that. Articular cartilage is completely devoid of vasculature. That's why it shows up normally white, and instead relies on compression via movement to pump out nutrients and pump in nutrients into the extracellular matrix from the synovial fluid. So essentially, if you can think of the way our articulations receive nutrients is essentially the same way a sponge pumps in and out water. So if you take a sponge that's dry, squeeze it and put it in a bucket of water, and then release it, it will absorb that water. As you take it out of the bucket, it will then carry that water until you squeeze it again. So this is the same way that your cartilage works, and this is going to be how we pump nutrients in and out of the actual joint. So just a little continuation here. Chondrocytes are responsible for the actual repair and maintenance of the ECM. So, and that's just extracellular matrix. I'm going to abbreviate that from now on. So These are essentially your blastic cells that are constantly building. And these cells are building dependent on the amount of force and loading you put into the joint. So, and we'll get into this later in the presentation, but one of the main reasons for osteoarthritis is a lack of use. And because of a lack of use, there is a lack of this continuous pump via movement and a lack of nutrients, a lack of getting rid of metabolic waste. And because of that, the joint tends to deteriorate. Of course, there are genetic factors that go into that, but a large portion of that has to do with just not moving. If you don't move, your joints are going to deteriorate. So let's circle back. As a bit of a detour, but so these collagen fibrils are actually what provide stability via crosslinks. The more crosslinks you have, the more stable your cartilage is going to be. But anyways, providing extra collagen, in this case via supplementation, and adequate joint movement supports chondrocyte activity and cartilage remodeling. So you're essentially providing the necessary building blocks and the necessary stimulus to build and maintain cartilage. So let's get into some of the literature. I've got 5 sources here, some of which are analyses or literature reviews. So they encompass many studies, and other ones are actual original clinical studies. Let's get into the first one here. So this is going to be a meta-analysis, and I wanted to include this because they're important, right? We've all learned the importance of the meta-analysis. So in this case, study selection was restricted to the same study design, which is going to be a randomized, placebo-controlled trial evaluating the efficacy of orally administered collagen on specifically osteoarthritis symptomatic patients or subjects. So this study and many studies going forward here use this WOMAC scale or the VAS scale, and essentially it's just a determinant of pain and dysfunction. In this specific meta-analysis, after criteria was applied, there were actually only 5 studies that met the same study design and again the criteria, and that led to a total of 519 patients. And all of these patients this entire mass of subjects either received a collagen treatment or a placebo group. It is important to note, of course, although the study design was similar, there were some differences in the studies. One being the type of collagen, so either bovine or chicken collagen. Some used undenatured collagen, others used hydrolyzed collagen. That's going to matter, but the study design is the same. That's what I think is primarily important here. And the range of intervention period was differed as well, between 10 and 48 weeks. So just a continuation here of that same study. The subjects were relatively the same in age, between mid-50s and mid-60s. And the collagen sources, the main collagen sources, again, included chicken and bovine, and those are pretty common sources of collagen. So all subjects, this is also important, I think, all subjects experienced osteoarthritis in the knee. So some studies measured other areas, but the main constant with each of the 5 studies was the knee. And again, just reiterating here, some of the forms that these interventions came in were hydrolyzed collagen, undenatured collagen, and then collagen peptides. So the results: the administration of oral collagen decreases the symptoms of OA. That's literally one of their sentences. So the results indicate a significant reduction in total WOMAC and VAS scores, and the placebo did not indicate any significant difference, positive or negative. So I like this study design for a couple reasons here, and we'll just back up. It is placebo-controlled, it is randomized, and it is testing relatively the same joint, although some of the details of the tests are different, the principles of the tests are similar enough to extrapolate out results across the 5 studies. So next we're going to get into just a quick review of the literature. This is an older study, so that's one of the main limitations of this study. This study was done in the early 2000s, 2005, which means it's pulling studies from even before that. There are some studies in the 80s here, but just because they're older studies, I don't think that necessarily takes away from the effectiveness of the study. So this included multiple study designs, and this is, again, one of the main limitations of this particular literature review. It included open label, double-blind, crossover randomized, double-blind placebo-controlled, prospective randomized, double-blind placebo-controlled. That's a bit of a tongue twister, but it included a variance of study designs. But the outcomes were generally measured as a change in pain intensity. So it didn't use WOMAC or VAS. It seemed like it was just straight up how much did your pain change, quantify that in terms of percent, and that's what we're going to go with. These studies were not only just limited to osteoarthritis, but also just joint pain in general, which I think is important. We're going to transition into some more of those kind of studies because that's where I think the application of this is so important, not just for osteoarthritis, but for just joint pain and joint health in general. But one constant is that these studies generally use 10 grams in a daily dose intervention pattern. So the results here, all 7 studies showed either a decrease in pain after collagen supplementation or an increase in joint performance. That joint performance, one of the studies used isometric knee strength testing. So as we go along here, we've got a 24-week study on the use of collagen hydrolysate as a dietary supplement in athletes with activity-related joint pain. So this was actually done at Penn State University, 2008, and used student athletes at Penn State. So it's a prospective, randomized, placebo-controlled, double-blind study that pulled data and pulled data from every sport, but ended up with 147 subjects after attrition rate was accounted for as the study went on. There were actually only 97 subjects that were able to be sampled. So that gets into our exclusion criteria. You couldn't have any joint pain or discomfort. So if you had these, you were not able to participate in the study. So you had no joint pain or discomfort, acute injury, ingestion of any of the number of glucosamine or chondroitin supplements that are consistent with reducing joint pain, and those who actually had to increase their supplementation due to joint pain. So those people were excluded. And then you see here the sample size ends up being 97. Those were assigned 10 grams of collagen, while the other received 25 milliliters of some placebo, which is xanthan, over 24 weeks. So some of the attrition was due to missed follow-ups, as you would expect with college students, faulty paperwork on the first visit, new joint discomfort, so think new injuries sustained, as you would expect, again, from college student athletes, adverse events, either with other medicines or allergic reactions, and then there was actually surgery in one instance and a car accident. So obviously they couldn't be involved in the study. But the results were that ingesting collagen hydrolysate showed significant improvement in pain at rest while standing and walking and carrying and lifting objects compared to the placebo. The placebo showed no significant improvement. And it's important to note these athletes were not diagnosed with osteoarthritis, no surprise, but instead reported just general joint pain, which, of course, osteoarthritis is a huge problem, especially in the United States with our lack of movement, but also a huge problem is just general joint pain. And that's where I think some of the application to collagen starts to really take hold is that this just applies to joint pain in general. So moving along here, we've got a double-blind, placebo-controlled, randomized clinical study on the effectiveness of collagen peptides on osteoarthritis. So this was double-blind, placebo-controlled clinical study, 30 subjects between the ages of 30 and 65. So subjects who met the actual criteria were enrolled in a placebo run-in period where they were introduced to a number of placebo interventions. I didn't list those because it's a super long list. It's like 7 different things. After the run-in period, subjects were randomized in a 2-to-1 ratio, receiving either collagen or placebo. So for those that, like myself, who are not good at math, 30 subjects, that means 20 received collagen, 10 received the placebo. And then subjects were prescribed their intervention as 5 grams in the morning and 5 grams at night. That's consistent with our 10 grams of dosing. You're going to see that consistently through every single study. And again, we're looking at the WOMAC score, VAS score, and another score here was the QOL. So the results, there was a reduction in WOMAC, VAS, and QOL scores compared to baseline, indicating a significant improvement in those who took the collagen peptides, and those who ingested the placebo showed no significant improvement. Moving on to our next study here, the vitamin C enriched gelatin supplementation before intermittent activity augments collagen synthesis. This was, I think, a really cool study. Although it has some glaring limitations, I think the extrapolation is very cool, and also done by a guy named Keith Barr, who, if you're not following his work, he's doing a great job in this field particularly, but just in connective tissue, how we can strengthen that area, but has done a ton of research into vitamin C and collagen supplementation. He was not the primary person on this, but still great work from him either way. So let's get into it. So we had 8 male subjects initially. That kind of slaps you in the face as a major limitation. Not a huge sample size. But these 8 male subjects consumed either 5 or 15 grams of vitamin C enriched gelatin or a placebo control. So blood was drawn before and after the supplementation, specifically 1 hour after the supplementation, to determine an amino acid profile. And then for 3 days, these subjects participated in jumping rope for 6 minutes, 3 times per day, with 6 hours of rest between sessions. So that's a total of 18 minutes of rope jumping a day. We'll get into a little bit more of that as we go here, but and then blood was drawn at 4 hours, 24 hours, 48, and 72 hours. And these blood samples were then added to engineered ligaments for 6 days. And this is where I think another major limitation, again, kind of slaps you in the face, is that they weren't measuring collagen synthesis necessarily in these subjects. They were measuring it in the engineered ligaments using some of the serum samples from the subjects. So you have to extrapolate the results a little bit here, but nonetheless, I think this is a great study to show that actually supplementing collagen does increase, and exercise does increase collagen synthesis. So the engineered ligaments treated for 6 days with blood samples collected before or 1 hour after subject consumed a placebo of 5 or 15 grams showed increased collagen content and synthesis. So I've got to, whoops, hold on, I'm freezing up here a little bit. Okay, well, I guess that's not going to work. So I had a nice little picture there to show you exactly how all of that worked. Unfortunately, you can't see that. I don't know why, but it just gave a detailed map of what these subjects actually had to do in terms of the rope jumping and what their schedule was. But I'll continue on here. Just with the study limitations, this was a small sample size. I mean, there's only so much you can do with that. Results not measured in the actual subjects, rather in engineered ligaments. I think that's a glaring limitation, and so we were forced to extrapolate out these results. So let's get into the nuts and bolts of the literature review here. So is it safe? It is. There's not a single thing that I can find that shows that collagen supplementation is unsafe. There are potentially some very mild side effects, which include heartburn and feelings of premature fullness. Maybe I shouldn't put mild in there. I'm not going to tell people what is mild and what is extreme, but to me, heartburn and fullness is not an extreme side effect. And additionally, collagen supplementation is completely legal, and there's nothing to indicate otherwise. So let's get into just kind of what we're looking at here. So we have a very popular collagen supplement here. This was the number one collagen supplement on Amazon. So probably a pretty popular site that people go to. If we look at some of the labels here, you can see that although it's not 10 grams, it's 11 grams, still well within that, I would say, a consistent dosing parameter with what the literature shows. And important here is that is third-party tested, provides adequate dosing, and is a single ingredient supplement, which is very, very important. You can see informed choice there. We've gone over that. I think definitely a supplement that you can trust to put into your body. So next we get into another product called NorCal. This is a little bit less popular. This one was tough to find. That's why I picked it. And if we look here, it is a single ingredient. There's a single ingredient. However, I guess we'll go over some of the positives here. Single ingredient supplement. It has more than sufficient dosing. It's way more than 10 grams. But I would like to see a third-party tester involved and the FDA's approval. I know the FDA isn't necessarily the strictest, but I would at least like to see some third-party testing just to validate that what they're putting in there is actually in there and that it is safe. So some of the practical applications in terms of dosing is I would recommend 10 grams per day. I think that's what's consistent with the literature. And most of the literature is going to use 10 grams. So whether you need more than that, I don't actually know, but that's not what, nobody really uses more than 10 grams. You can do 5 and 5 in the morning and at night, or 10 grams in the morning. And intake should be taken daily, and also with food. Now, that last research article showed that with vitamin C, you don't necessarily have to take it specifically with vitamin C, but any type of citrusy fruit will also work. But just in food in general is going to contain vitamin C. If you're eating a wide variety of foods, so taking it with just food is going to be just fine as well. And also to throw in there, it's important to note that a daily dose of exercise is also a very, very effective way to increase the results of collagen supplementation. And then for athletic populations, this is not a banned substance. You can take as much of this as you want. So we look at a cost breakdown here. I just took 3 supplements, our first 2 that we went over, and then just the bulk supplements. I actually take the bulk supplement down at the bottom. But what you're looking at is between 60 cents and $1 per serving per day. So that's 60 cents per day, $1 per day, and 62 cents per day, which I think is more than reasonable, especially considering the bulk of evidence that shows that this can potentially help with symptoms of osteoarthritis and joint pain. So just a little conclusion to wrap this up. The efficacy is extremely high in collagen supplementation. So it is my recommendation that, first you understand any potential risks, but they're pretty mild. Food sources of collagen include any type of gelatin derivative or animal product. Specifically, if you're eating a steak, eating all the sinewy, chewy stuff, not just necessarily the meat, is important. If you can stomach it, is a great source of collagen. So food can provide more than enough collagen. However, I think just reasonably thinking about this, there's tons of inconsistencies with diet. You may not eat meat for a few days depending on where you are or who you're with. So I think that supplementation is a reliable way to get the adequate amount of collagen that you would need on a daily basis. So we'll just briefly end here with my recommendation. I couldn't help myself, so I gave it earlier in the presentation, but I would highly recommend collagen supplementation. The literature is resoundingly clear that collagen supplementation is beneficial for maintaining joint function and mitigating the effect of osteoarthritis. And some of my references here, again, this is the guy bar at the bottom that you can see. Thank you guys for paying attention here and listening to my presentation. Any questions, just throw them my way in the discussion board, and I'll be happy to answer and help out.